Welcome, everyone, to today's webinar, Modernizing Your Medical Device Supply Chain. This webinar is made possible through the generous support of Cardinal Health. I'm H&HN Senior Editor Susanna Hopsalerin. Each year, there is significant waste in the supply chain for high-value medical devices, amounting to a staggering $5 billion in annual losses. As hospital margins are eroding due to the rising cost of materials, coupled with the pressure to reduce costs, health systems are looking to drive significant efficiencies and waste reduction without compromising clinical satisfaction and patient care. During today's webinar, Paul Farnan will examine methods for managing high-value medical devices, discuss the benefits of automated inventory management enabled by RFID tagging technology, describe how to reduce clinical time spent on supply chain functions, and free up more time for patients. Our webinar will begin with a presentation by Paul Farnan and will conclude with a question and answer session. To submit a question to be addressed during the question and answer period, please click on the Ask the Question button at the bottom of the console. Simply type your question in the box and hit Submit. Questions can be submitted at any time during the presentation. The slides will be sent to participants after today's webinar. Let me briefly introduce today's speaker. Paul Farnan has more than 27 years of experience providing leadership to hospitals and healthcare systems. He is currently responsible for supply chain development and leadership of Cardinal Health's medical device and implantable solutions service offerings. Paul's full understanding of the primary importance of patient care and the critical nature of quality to healthcare systems has enabled him to successfully achieve material efficiencies and deliver cost savings through collaborative efforts and goal setting with hospital and supplier partners. It's now my pleasure to turn the floor over to Paul, who will begin our presentation.
Susanna, thank you for that introduction, and thank you to H&HN for this opportunity to address this audience. And thanks to the participants out there who logged on today, taking time out of your schedules to engage with me on what I think is a really exciting opportunity in healthcare, specifically in the medical device supply chain. And I'm anxious to share with you some of our vision, some of our learnings, and hopefully hear some of your ideas in the question and answer session. Just a couple more minutes, or a couple more seconds, if you will, about me, just to give you a little bit more on my background. As Susanna mentioned, I've got the dubious honor of 27 years in the healthcare industry. But I've been fortunate enough within Cardinal to work in several different parts of the business that I think have sort of educated me or colored my opinion on some of the topics we're going to discuss today. But I started in our sales and sales leadership organization, working within our distribution business, and really got a chance to learn a lot about supply chain, how hospitals run, and specifically the importance of having the right product in the right place for our providers. I had the opportunity as well to work on the operational side of our business, actually ran one of our distribution centers, and again gave me a full appreciation. As I tell friends and family, it was like going back and getting my MBA in logistics. When you are responsible for processing orders and on-time deliveries to hospitals, in many respects, we do the same thing, meaning the responsibility of the materials management team is the flow of product to the clinicians, and Cardinal and my experience in the operations, we were joined at the hip in making sure that we processed your orders and delivered your products on a timely basis. So that certainly helped me learn much about some of the challenges that our hospital customers and IDN customers face, as well as the role that Cardinal might be able to play to assist our customers going forward. And then more recently, and the purpose of our discussion today, I've spent the last 5 years in a marketing and new business development capacity. So we're trying to take some of Cardinal's expertise in what I'll call the commodity or med-surg supply, kind of the nursing products, the general patient care items, and take some of our best demonstrated practices, some of our newly acquired technologies, and apply them to the clinical supply chain. And we think that this is a timely and needed opportunity for the industry, and we'd like to share with you today what that might look like. So if you think about what we'll cover today, from an agenda standpoint, we'll talk about kind of a new vision or new model for the med device supply chain, why we think the timing is right for some change in that area, and we'll share with you a real-life example, a case study, about 18 months of real work that we've done with a manufacturer and an IDN to prove out some of the concepts that we're going to review today. To start, I'd like to take a step back and remind myself, and hopefully this slide hits home with many of you on the line today. We live and work in a very complex healthcare supply chain. The almighty dollar is in the middle of this slide for many reasons, but it certainly highlights the cost pressures, the reimbursement changes, the margin challenges that manufacturers face. Everyone is sort of squeezing that dollar and trying to manage costs more so than ever. Challenging to add to that challenge are some of the obstacles that we encounter every day in healthcare. One being inventory systems, that there are typically multiple inventory systems within a hospital. And then on top of those systems, you have manual systems as well. So you've got literally people using pencil and paper, or at best Excel spreadsheets, to track inventory, along with different systems across different departments and even different systems across an IDN. One of the other challenges we've noted is the barriers around data sharing, and we'll talk in a moment about some other industries who we think might be worth copying or sharing some of their best demonstrated practices. But today, whether, again, it's within an IDN or if it's across industry or up and down our supply chain, there hasn't been much in the way of data sharing across business partners. And finally, the complexity of our product line. So coming into a hospital or IDN, there are all kinds of products with different inventory, handling, special requirements, refrigeration, expiration dates. Obviously, what we handle in the healthcare supply chain, no two items are the same. And that gets us into one of our focus points today, and that's the medical device implantable supply chain. So all of the challenges we spoke about a moment ago that are generic to all of healthcare supply chain, as we focus now into the clinical areas of the hospital and some of the medical devices used in those procedural areas, you know, the stakes of poker kind of go up. You've got items now that are very physician preferenced or physician sensitive. They're being implanted in a patient in many cases. They've got expiration dates on them, and typically are certainly higher value items than you might see on a patient floor or nursing unit. So a few years ago, Cardinal started doing some research in this area of the medical device supply chain, and there's two sources that combine to put together the bar chart that you're looking at. But let me focus your attention on the different colors on the bars. The red bar represents the manufacturer waste, or I'll call it opportunity. And for most of the folks on the phone today, the gray bars represent opportunity within the medical device supply chain for the provider. And the big number of $5 billion, and that's 5 with a B, billion, is the opportunity or the estimated loss or waste in this med device industry. And the bar chart highlights some of those areas of opportunity and who can derive those benefits, whether it be the manufacturer or the provider or both. Obviously, the tallest bar is the revenue capture opportunity for the provider, and that's simply making sure as you're in a procedure, in a case, capturing the items that are used on a patient, getting them on the patient record, and potentially serves as a cost basis for reimbursement. And then certainly some of the other bars represent some of the expense or waste associated with inventory management, whether it's the processing of an order, the inventory holding costs, the expiration of product, up and down this supply chain, there screams opportunity, and that's what got Cardinal's interest in taking some of the work we've done historically in the commodity area and wonder how we could bring support to this high-dollar med device area. I thought it'd be important for us to go a little bit deeper into some of the pain points that exist in this medical device supply chain today from a couple different points of view. The first one we'll look at in this slide is the manufacturer's pain point. So think about your med device manufacturers, your Boston Size, your Medtronics, your Zimmers, all of the folks that play in the med device implantable arena as a manufacturer. They're facing challenges as well. So I've highlighted a few here, the first one being demand planning. So what that means to a manufacturer is having visibility into how their product is consumed, when it's consumed, and having visibility to that demand. So today, many manufacturers ship product directly into a hospital. Hospital certainly cuts that PO to the manufacturer. But where some of the visibility is lost and some of the, I'll say, poor timeliness comes in, is that product that the manufacturer shipped may sit on the shelf at the hospital for a week or a month or 6 months. The manufacturer really has limited or no visibility into once their product is actually utilized or consumed. So as a manufacturer, that signal of demand is what would set your cycle time around how much to manufacture and when. So we sometimes call it the bullwhip effect, where if the manufacturer is not getting real-time information, they're sort of guessing as to how much to make and when to make it. So that represents a challenge today and as an opportunity as we see it. And some of this demand planning leads to the other couple of bolded words in the slide here. Because there isn't much transparency of information, the manufacturer, particularly when they're responsible for consigned inventory, will err on the side of overstocking, bringing in extra inventory so that you get this sort of never run out mentality and make sure that the clinician has what they need, and sometimes that leads to overstocking. And maybe the only worse thing than overstocking is, I'll say, understocking or stockouts as indicated here, which obviously is a failure that none of us want to see happen in any procedure. But those are some of the big pain points or challenges from the manufacturer perspective. Let's jump over to the provider, and hopefully these are pain points that you guys can validate with me, but when the hospital looks at their clinical areas and procedural areas, they look at challenges and pain points associated with expired product. So if a product sits on the shelf too long and is not used, obviously there'll be an attempt to return it to the manufacturer, but in some cases it expires right there on the shelf, and that leads to a write-off or expense to the hospital. We've also gotten feedback from many clinical departments around labor costs associated with managing inventory in the medical device or clinical space. So in many cases we have clinicians, whether it be in the OR or the cath lab, they are spending time managing inventory levels, and we feel that maybe there's an alternative here through the combination of different technology and maybe different people involved that could free up clinician time, and we'll talk more about that. Another piece of feedback we've received from hospitals is sort of this blessing and curse of bulk buys, the temptation of taking advantage of lower pricing, but some of the consequences or challenges that come with it. We'll talk more about that here in a moment. And to no one's surprise, if you kind of push this together and look at these common pain points across both manufacturer and provider, depending typically on who owns the inventory, you're going to see who's experiencing the pain or the challenge. And in a consigned environment, typically it's the manufacturer who's having to deal with expedited shipping costs or expired product. But if it's hospital-owned goods, you'll see the hospital, with responsibility for managing that inventory and shrinkage or loss product that results from it. And it's a hodgepodge today. It varies by product line, it varies by manufacturer, it varies by hospital in terms of who has inventory management or inventory responsibility. Sometimes it's the manufacturer, sometimes it's the hospital. In many cases, it's both. Before we go into some of the maybe new ideas or visions of how we can improve this supply chain, I thought important we talk about some of the traditional approaches that maybe are not delivering the value that they used to. We talked a little bit earlier around pricing pressures in the industry. I would tell you, especially in the med device area, these pricing pressures are increasing. So what I mean by that is, from a supply chain or procurement perspective, I think hospitals have done a great job over the years in focusing on reducing the price, reducing the cost of many of their commodities through active bidding, through value analysis. We've kind of squeezed that stone somewhat dry with many of the commodity areas. So we're seeing a lot of the procurement and purchasing teams within hospitals shift some of that same focus now to areas like physician preference items or medical devices and implantables, areas where historically they were told not to focus their attention. But now with all the reimbursement pressures going on in healthcare with the Affordable Care Act, many more C-suites within the hospitals are taking off the gloves and asking their supply chain teams to focus more of their time and energy on what might have been physician preference or items they were not allowed to work on in the past. We're also hearing feedback from both manufacturers and providers around the value of consignment. It certainly is a big part of this medical device supply chain, but many folks are starting to wonder if there's a better way and a different way to go about managing inventory other than consignment. I think in many cases consignment was a path of least resistance. Many of the clinicians running these departments didn't want to be bothered with managing inventory. It also gave the med device manufacturing reps a reason to be in the department on a weekly or monthly basis. So it served them well as an excuse to be in the department. So we're starting to hear different ideas around modifying or reducing consignment within some of the clinical areas. I mentioned bulk buys earlier and kind of described it as a double-edged sword, and I wanted to go a little bit further on this. As a supply chain purist, we typically don't recommend bulk buys in any form or fashion, largely because it creates that sort of false positive, if you will, or that spike in demand that is not sustainable or I'll say real. And when any industry or any supply chain has sort of a one-time spike, it tends to create issues down the line. But having said that, we also know there's a lot of bulk buys taking place out there because of some of the short-term benefits that are derived from cost reduction. And every manufacturer, or at least most manufacturers, will trade volume for price, and we know that whether it's at a quarter end or year end, many manufacturers are out there offering this. But I did want to pause and just make sure folks on the line know that there's, sort of the other side of that coin, that from a bulk buy perspective, it can tie up a lot of money for the hospital. It ties up space. You need a place to put this. And it also tends to come back to haunt you if you now own this product and you end up not using as much as you thought, or a surgeon leaves, or you change practice or procedure, and now you're stuck with product that you thought you would use and now you can't. So that is some of the downside, if you will, of bulk buys. So it's challenged Cardinal to look at some new vision, new applications, new perspective, and we're anxious to share some of those thoughts with you today. One of the points of reference we turned to stimulate some of our innovation here was the consumer goods marketplace. So think about your retail experience, and in this example, I'm using the Gillette razor here. And if you look at this slide, you got a couple rows moving from left to right and right to left. But let's start at the bottom, and this is sort of your traditional supply chain. And whether you're talking about a healthcare supply chain or in this consumer goods example, they're not very different. The manufacturer is producing the razor, typically using a distributor to get that product into the supermarket or into the CVS or Walgreens pharmacy, where we as consumers are marching in there and buying it. The circles and arrows you see above the logistics flow represent data. And this is where we got really interested in examining this industry and this model. And again, if you go to your example of you or I walking into the corner drugstore and picking out this razor, we know that when we walk up to the cash register and the attendant scans that product at the cash register, there's a lot that happens in the consumer goods industry. First and foremost, there is a demand signal created, and a demand signal that is shared all the way back to the manufacturer, as this slide now represents. So that data is now telling Gillette that Paul has just walked into a drugstore in Pennsylvania. He's purchased a razor. It also informs not only Gillette, but in many cases there's a consumer goods aggregator, someone like Nielsen, or other companies who also want to study the behavior patterns of consumers. So they're studying how many razors has Paul bought this year, why did he buy the extra skin sensitive this time and not the regular one, and it's looking at my buying habits and again, educating the manufacturer and the drugstore as to what those trends might be going forward. So we found a lot of interest in this sort of sharing of data, this sort of end-to-end visibility that is done in some other industries. And obviously we started asking the question of why can't this be done in our industry? Why can't it be done in medical device? The flow of the product is not too different, but it seems to be this barrier around sharing information that might be the opportunity for us to look at. So about 2.5 years ago, Cardinal made an acquisition. We did a pretty deliberate search to look at how we could upgrade our supply chain or distribution platform. And one of the technologies we were interested in knowing more about was RFID. And one of the leaders in healthcare was a company out of Boston called Wavemark. And we did a lot of interviewing of their customers. They had been in the healthcare business for over 12 years at the time. They'd had a lot of success with RFID in some of the clinical areas of the hospital. And Cardinal was interested in how we could use RFID within our distribution centers to do a better job of tracking and tracing product coming in and out of our distribution centers. And we actually found this to be maybe a perfect marriage. And historically, Cardinal's only played in the commodity markets or commodity product lines. We distribute a lot of Band-Aids and bedpans. But we've always been reluctant to get into the business of medical devices because of the high cost and the risk of losing or having expensive product expire. But once we looked at how this RFID technology could come into play, it gave us some more confidence to look at a process and a technology that could help us manage inventory in a way that would limit risk to us, the manufacturer, and to the provider. So we started down this path of this idea of an end-to-end supply chain and creating visibility up and down that supply chain. And we highlight RFID technology, but as we'll speak to in a moment, this is not just RFID, but it's a family of technology or a grouping of technology to make sure we have the right level of technology managing the right inventory. So many hospitals use barcodes today. We're a fan of barcodes, and we see that as part of this solution. But we'll speak here in a moment about how this inventory management of barcodes and RFID tags may get us to a better place than where we are now. So if I could take this vision a bit further and look at it now across our med device industry, where you have multiple manufacturers that are historically shipping direct into a hospital, could we introduce a logistics element along with the technology element I just described? So if you're an IDN today and you're ordering product from many manufacturers, you're typically storing product across many hospitals. So we looked at this idea of a regional distribution center, whether it be a hospital-owned warehouse or a Cardinal distribution center, but how could we aggregate inventory into fewer locations? And we feel this aggregation of inventory is a key element to this vision or to this solution. Not only is there a technology play, but this consolidation of inventory into fewer points, we also think leads to better inventory management practices. So think of this solution as two parts, kind of an RFID-enabled analytics and how we better consolidate or aggregate inventory into fewer locations. So to test this concept, test this vision, we felt that we wanted to partner with some providers and partner with an IDN to explore what this might look like. So we happened to partner with a large IDN in the Midwest, and coincidentally, they had started down a similar path. Much like Cardinal was exploring the virtues of centralizing medical devices into one consolidated service center, so was this IDN. And coincidentally, they were also looking at technology. They had gone out to the market, looked at over 12 different solutions for inventory management tools associated with managing physician preference items or medical devices. So we were first, jointly surprised that we were heading down a similar path and decided to kind of join strategies and work together on piloting or testing what this might look like. And to the credit of this large IDN, as much as they wanted to reduce costs and improve quality and deliver clinical and patient satisfaction, they also had in the back of their mind this idea of capturing data. And that's what this next slide represents. Whether it's a barcode or if it's an RFID tag, ultimately it's a way to gather information and convert it into usable and actionable information within your IDN. And that was one of the goals that we set in this pilot with this IDN, was not only to improve the supply chain, but use a technology that would be cloud-based, that would be common platform, and be one that would push out actionable reports that could actually change behavior and enforce this vision. So some of you may be familiar with RFID technology, many of you may not. And again, RFID is just sort of one element to this solution, but I thought I'd kind of give you this picture to show you how the technology works. And typically it starts with a RFID tag, the left-hand side of this screen, where hopefully as close to the point of manufacturing as possible. An RFID tag is applied at or with the manufacturer. That product then comes into the clinical space, and that's where you see this cabinet or the storage area, if you will. This is an RFID cabinet, and it's reading the RFID tags that are on these products every 20 seconds. So you're getting real-time, 24/7 visibility into what you have, lot number, serial number, expiration date. And we'll talk about how this technology, whether it be cabinets or some RFID wands that we have as well, integrate into both your inventory and clinical systems. So to that point, as we move to the right one more time into this area we call use, we're now moving into the clinical space. So this could be your cath lab or your interventional radiology, your EP lab, or even your OR. And now, once the product is being used on a patient, and this is the product here being waved in front of a point-of-use reader, it does two things. Number one, the product is now being matched to a case or to a patient. And secondly, it's being acknowledged or decremented in the inventory management system. So this RFID technology is feeding existing systems that are in the hospital today. So many of you have clinical information systems like Cerner or Epic. Many of you have materials management systems like PeopleSoft. And this RFID system is interfaced into your existing or legacy systems and populating or talking to those systems. And what this does is lead to the right to the replenishment and analyze and optimize. And this is where the data is collected into a single analytical platform that gives you that knowledge of what's getting used in these departments, on what patients, at what frequency, and has both standard reports and does some custom reporting around seeing products well in advance of their expiration date. So you've got a time to move inventory around within your IDN. It's adjusting par levels or making recommendations to adjust par levels. It's really capturing this data, turning it into real-time analytics for your supply chain and your clinical teams to use to make decisions. So let's go back to the pilot that we conducted at this IDN. Working with this large IDN, we chose Cook Medical as the manufacturer to work with us in the pilot. And although it was a 12-hospital IDN, we chose 3 hospitals and some clinical departments within each of those 3 hospitals. So we ended up choosing 2 cath labs and an endo lab across these three hospitals. And by getting RFID tags on the Cook products before they came into the Cardinal distribution center, we got that early visibility that we could track the product from the point of manufacturing all the way into our aggregated or consolidated inventory point, which was a Cardinal distribution center in this city. And that led to some really great results around managing inventory at the clinical or department level, where we also put RFID technology as well as barcode reading technology in these hospitals and in these clinical spaces, the endo lab and cath lab. And we now had this end-to-end visibility that the manufacturer could see their product en route to Cardinal as a distributor. They could see their product on the shelf in our DC. They could also see the product on the shelf within these 3 hospitals and clinical spaces, and vice versa. Now, this hospital also had visibility into inventory all the way back through Cardinal and back to the manufacturer, and we were now providing these exception reports with real-time information, not 30-day-old information, not quarterly information, but real-time information on some of the most expensive and dated products within these departments. So as you can see, some of our statistical results on these slides that we documented over this 12-month pilot. We met we met monthly to review the results, but just as important as the financial results, the reduced inventory levels, the reduced expired product, we found great engagement by the clinicians. They saw this new system freeing up their time, freeing up their sleepless nights, worrying about having the right inventory. As the system proved itself, the clinicians became believers. As a matter of fact, at one of the pilot hospitals, they became so confident in the system that they moved away from consignment. They had some of their cook items on consignment, and with our blessing and Cook's blessing, moved to a hospital-owned inventory model for those products because they felt like they had the people, the technology, and the process to manage them better. So we were very thrilled by the clinical engagement and the feedback we received from the clinical team. So if you look at this from across the players in this pilot, Cook certainly benefited from this process by having visibility to their products on an iPad or a PDA that their reps never had before. So they were gaining much better clarity around where their product was and how to manage it and manage its inventory. From an IDN perspective, as you all know, managing inventory across multiple hospitals is always a challenge, and this allowed this IDN to consolidate inventory into fewer locations and track and trace inventory up and down the supply chain. And certainly for Cardinal, we felt that this gave us a foothold as bringing value in the clinical space, in the medical device space. As I mentioned, historically, we'd focused on sort of the commodities or medical, surgical, disposable items, but now we were moving into inventory management practices and bringing inventory management value into physician preference, and that, to me, was important to Cardinal to expand our relevance and expertise. So certainly a win for all involved. So you may be asking, since the pilot ended, what's the next step? And we're excited to share that this IDN has decided to expand outside of the 3 pilot hospitals and is moving the technology sort of department by department, hospital by hospital across their IDN, which is very exciting and a journey we're anxious to take with them. From a manufacturer perspective, I mentioned some of the iPad sort of real-time benefit that they were seeing. One of our values that we tracked for Cook was sales rep productivity throughout the pilot, and we found that their sales rep became one of the biggest fans, biggest supporters of this technology. That historically he would have to run from hospital to hospital across this IDN to understand where there might be shortages or potential stockouts. But now he was working with real-time data that he was able to proactively avoid problems and prevent problems as opposed to sitting around waiting for his phone to ring with emergencies. So Cook became a very strong believer in the analytics. I mentioned earlier about this sort of family of technologies, and we've seen situations in our industry where we sometimes jump to the highest common denominator, the most expensive solution, and we try to apply it everywhere. And that's hopefully something we've learned from here, and Cardinal's recommending a different approach. So as you notice this slide, we start with low-cost products on the left, and we move to high-cost products on the right. And along the bottom, we're recommending different inventory management tools depending upon the product type. And we're sensitive that we want to have a common workflow within the hospital and specifically within the clinical department so they don't have to manage many different systems. But we feel that our system, because it's off of a cloud-based platform that reads both barcodes and RFID tags, we found this right blend where we're using barcodes on lower priced items, or we're using a very simple 2-bin Kanban on high volume, low cost items. And as you move to the right, there's a smart wand that reads both RFID and barcodes, and all the way to the cabinet that we discussed earlier, which now in this cabinet we've only got the high cost, high value, typically products with dating. Those are the right products to be in RFID cabinets, and we've got other tools to manage the other products. So hopefully this sort of family of offerings rings true to you, because we know as an industry sometimes we have jumped to one extreme or the other here. The next slide represents to me kind of a look backwards and our lessons learned during this 12-month pilot with Cook and this large IDN. And when I think back around the journey we took together, it highlights, some of the basics of any partnership. But as you look within your IDNs and your health systems around how to collaborate with a partner to solve a problem, whether it's medical device related or otherwise, having a shared vision with your business partners, and committing resources was something that Cook was quick to step up and do. Cardinal was quick, as was the IDN. All of us had some background in Lean Six Sigma, so for those of you familiar with a Gemba walk, it's simply kind of walking through the supply chain, looking at the actual users and consumers of the supply chain, understanding what their challenges are, and understanding how to make sure we leave alone what's working and focus on only what's broken is something we learn. And I can't, encourage you enough to make sure you engage your clinicians early in this process, as well as your IT counterparts, who all play a vital role in making this vision come together. But we called this slide a true collaboration because it really was. And as I said, we met every month to review our results, and we wanted to document not only value to the IDN, but also document value to the manufacturer, and we had to measure that carefully for all parties. So hopefully the story I shared with you, our case study, the results that we drove, this blending of technology and consolidation of inventory locations, gives you a little bit of courage to look within your own medical device supply chain and sort of venture down this path with us to look at how we can better manage, better control what has been largely independent or run separately out of the normal supply chain in the hospital. How could we use some of the same historic best demonstrated practices we've used in the patient care areas and apply some of that best demonstrated practice into these clinical areas? We're very excited to go down this path with our manufacturing partners and certainly with you as our provider customers as well. And that gets us to the end of the presentation. I know I'll turn it back over to our moderator here and go through some Q&A.
Thank you, Paul, for your presentation. We will now begin the question and answer portion of today's event. As a reminder, you may submit a question by clicking on the Ask the Question button at the bottom of the console. Simply type your question in the box and hit Submit. Our speaker will answer as many questions as possible in the time remaining. Questions that are unable to be answered in the allotted time will be shared with the speaker for follow-up offline. Some of you have asked about the slides. They will be sent to you tomorrow in an email with a link to this webinar so you can share it with your team. For our first question, what does RFID stand for, and what level of capital costs would a standard-sized urban hospital expect to incur when adopting RFID technology?
Well, RFID is radio frequency identification. It's a technology that's been around for dozens of years, used in many other industries. As I mentioned, when Cardinal acquired WaveMark, it had been used extensively in healthcare for about the last 15 years. I'm glad you brought up the question of cost, and I'll convert that into kind of a conversation here around return on investment, and because that's the way we look at most business cases and certainly this solution. And I'm proud to say that we're seeing great ROIs for the provider customers who have utilized this technology and this service. Typically, we're seeing returns after the first year of implementation of 2 to 3 times their investment. And we're also doing a lot of education here around RFID. I think many people maybe became familiar with RFID about 20 years ago when Walmart made kind of a splash with it. And there were conversations back then around the cost of an RFID tag. And fortunately, like any technology, much of the cost has come down. And as I mentioned in one of my slides, I think this idea of using the right inventory tool for the right products also gets you to a more reasonable cost. But what we would recommend any provider do is a business case with an ROI, but Cardinal and other suppliers out there should come in and make sure they work with you and your clinicians, understand your workflow, understand your space constraints, your patient and clinical constraints, and make sure you get sort of a custom build out of the right amount of technology, that we don't go crazy with too many cabinets, but rather find that right blend for your hospital. And I think if we do that due diligence up front, the ROI numbers are only going to get better.
Other than dollars, what are other benefits from a better managed supply chain?
I'll tell you, one of the great outcomes of our pilot was the subject of recall management. This is a headache for everyone in the supply chain, and we were pleased to hear great feedback from Cook and great feedback from our IDN pilot accounts that RFID turns out to be a tremendous way to manage recalls. So we all know there's too many recalls in our industry, and when they happen, there's a huge responsibility for the manufacturer and the hospital to remove product from the shelf or find it wherever it is within your IDN. And sometimes finding it is a full-time job. So as you can imagine, the RFID technology literally will tell you where it's at, what department, what shelf, and we produce a report associated with product recalls that give you that roadmap or help you work with your manufacturer with product recalls. So that was one of the great, I'll say, pleasant surprises around using the technology. The other benefit, I'll say other than dollars, was the feedback from the clinicians. Twofold. Number one, around their level of satisfaction, that we were not disrupting their workflow. As a matter of fact, the technology enabled it. It simplified it. They weren't having to chart manually what they were putting in a patient. They weren't having to replicate multiple systems. The fact that the WaveMark technology integrated with their existing systems was a huge benefit to them. And then secondarily, their time. They really felt like inventory management was not their forte or their expertise, nor what they should be spending most of their time on. So the benefit we saw was allowing them now to spend more time with patients. So that was, again, another success story coming from the pilot.
What kinds of technology are required to implement the supply chain improvements you've talked about?
Well, I guess at its highest level, we're always going to recommend that we're sensitive to workflows, if you want to call that a technology, that we're enhancing them or simplifying them. That's one critical area. The second is analytics. As I said, if there is a key to this solution, it is capturing the demand signal at the patient and then feeding that demand signal, feeding that data in the form of information and analytics both to the hospital and in some cases to the manufacturer. And having this sort of shared platform, one that integrates systems, allows systems to talk to one another as opposed to layering another system upon another system. So those, from a high-level perspective, are how the technology can come together and key elements to think through as you map out your action plans.
Is the healthcare industry really so bad at managing its inventory?
We're horrible. No, I'm kidding. I would say that we're getting better. And I think it's ironic because I've spent most of my career managing the med-surg commodities and working with hospitals around how to improve inventory management on tongue depressors and cotton balls. And I've seen us invest lots of money in process and technology on the nursing units and in the patient care areas. And I've always been surprised we haven't carried that over into the clinical space, which is, to me, the place to take these best demonstrated practices. Why aren't we bringing our best knowledge into those areas that need it most? Get clinicians back focused on patients and bring in better process, better technology into these areas who historically have sort of operated on their own. And I see this as a win-win for all involved.
Why focus on the medical device supply chain as a priority?
Well, we've alluded to this throughout our conversation today, but I'll highlight maybe a couple of other areas. I mentioned the procurement and purchasing teams within hospitals have hit really hard on some of the commodity product pricing over the last few years, and more administrators are asking them to shift their attention to medical device. Certainly, hospitals are facing challenges around new reimbursement models, and getting a handle on your cost per procedure is step one in understanding how you're going to make money or not make money on a procedure. So the better you can understand what's being utilized in a procedure, the better you can produce analytics to share product usage across your physicians or across your IDN. This creates tremendous opportunities to standardize practice and bring down costs that will help hospitals deal with many of the revenue or reimbursement challenges they're facing here with the Affordable Care Act.
Describe what you mean by high-value supplies, and please provide an example.
Yeah, beauty is in the eye of the beholder here. We've sat down with many med device companies and asked them to give us some thresholds. Most of our initial work has been in the interventional cardiology area, so a lot of our focus initially has been in the cath lab, and we've learned a lot about stents and guide wires and many of the different products that some people refer to as physician preference or others call high value. And we're working closely with our pilot customers around identifying a threshold so that going back to our earlier examples of when do I use a barcode and when do I use an RFID tag, and there's many factors that go into that decision, but we're narrowing in on a threshold right now with the help of our providers and manufacturers of around $200 is one of the initial thresholds where we think applying the RFID tag and managing those items, particularly those with expiration dating, particularly those that are very service sensitive. Like I said, many criteria go into this, but for the purposes of your question today, we found this sort of soft spot right now. If anything over $200, we're classifying as something worthy of putting an RFID tag on, and then kind of under $200 threshold, typically we're using traditional barcode technology.
Paul, what industry do you look to as a leader in supply chain management excellence, and what does healthcare need to follow?
Well, to the credit of healthcare, I think now more than ever, we're all looking at other industries for best demonstrated practices. We've seen a lot of supply chain leadership come into hospitals lately from other industries, and it's exciting to see how some of those concepts are being transferred from areas like aerospace, areas like automobile, any other manufacturing worlds, and how they're being applied in healthcare. And we know healthcare is unique. We know it's special. We know there's nothing quite like it, but I give the industry credit that we are trying for the first time in a long time to incorporate best demonstrated practices. And I think some of those right now are some of these principles around Lean and Six Sigma. You know, whether you're a believer in one or the other or both, there are some applications that do fit into healthcare, and I think we shared some of those today, how to better capture demand signals, how to share data across and up and down the supply chain. Those are practices that other industries have been doing for years that are driving great savings and benefit. But at the end of the day, making sure patient care is number one and never compromised is certainly a guiding light when we compare ourselves to other industries. But to answer your question, I have found a lot of interest in the automobile industry. Maybe it's because I grew up in Detroit and my dad worked for Chrysler for 30 years, but we've learned a lot from them in many regards, and there's certainly other great companies and industries out there we can learn more from as well.
That concludes the time we have available for questions. In the next few days, all attendees will receive an email that will include a link to the archived webinar session and slides. Thank you to our audience for joining us. Thank you to Paul Farnan for sharing your insights on new approaches to inventory management that increase efficiency, reduce costs, and improve clinician satisfaction and patient experience. Thank you to our sponsor, Cardinal Health. Thank you again for joining us. This concludes today's program. Have a wonderful afternoon.